Hi, Brianna Lujan, BN49. This is video 4. This one will be talking about hydrocolloid dressing, ECG tracing, and pelvic exam. So, for hydrocolloid dressing, why do we use them? The dressing itself keeps wounds moist while insulating and protecting it from external contamination. It also provides thermal insulation to keep wound warm, and they are also not used when there is an excessive amount of drainage. For the ECG tracing, it says to demonstrate the lead placement, but in the book I had a hard time finding exactly where the placement is. I know it says extremity electrodes go on the inner aspect of the upper arms and inner aspect of the lower legs, and also the chest electrodes placed in correct sequence on the chest. But I looked multiple times, like on Google, and I don't know if it's a 12 lead or there is a 5 lead. So I'm not exactly sure where the inner aspect, I'm assuming like right here, but that I am kind of unclear of. But it says, what would you do if the patient has a hairy chest? You would shave them, because the hair would interfere with the adhesive, so it wouldn't be able to stick to the skin. And then how will you know if the lead is applied correctly? From the book, it says if the tracing is on an even line and without any vibration lines, then it is correct. So if it's the opposite, then that's how you know it's incorrect. So basically, you want to make sure the line is even and you don't see any sort of like vibrations. And if you do see any of that, that means there was an electrical interference. For the pelvic exam, what supplies do you need? There's a lot. Gloves, saline solution, examination table with stirrups, examination light, vaginal speculum, biohazard waste container, cotton tipped applicator, cervical scraper, patient gown and drape, lubricant, examination stool, thin prep specimen container, a pencil, pathology requisition slip, and cytology fixative. And then, is the doctor allowed to perform this procedure alone with the patient? In the book it says a chaperone may accompany the patient, but also it depends on the facility policy. Whenever I had it done, I never had anyone with me, so I'm assuming that facility policy stated that you don't need one, but here it says that it's needed according to facility policy. So yes, that is video 4.